And this week's Pet Advice brought to you by University Veterinary Care Center, Anxiety in Pets and Treatment. Dr. Amy Guernsey is joining us now. Dr. Guernsey, good morning, and thank you for being with us.
Thank you for having me.
Well, we're talking about anxiety in animals. So how does it present itself in, say, cats and dogs, and what do you typically treat?
Okay, so most owners have at least some familiarity with circumstantial anxiety. We're talking thunderstorms, fireworks, trips to the vet or groomer, travel in general. The animals that get kind of wound up, hard to settle down, that sort of thing. Outside of that, there are animals that have more generalized anxiety. They have that level of, I can't calm down, really all the time. And then the next step up from that are the animals that exhibit stereotypic or almost OCD behaviors and can even progress into self-harm. I see that more often with cats and birds, but it can happen in dogs as well.
What does that self-harm look like in a pet?
So for birds and cats, it's a lot of times over-grooming to the point of hair loss or feather loss or even skin damage. Yeah. Trauma.
Okay. Well, what types of medications are available to help treat anxiety?
There's a whole plethora, and honestly, a lot of them are used much more commonly on the human side. I'll often be in an exam room talking with an owner, talking about fluoxetine or clonidine or trazodone or gabapentin, and they go, oh, well, I'm on that. So owners often have some familiarity with these medications. What drugs we pick kind of depends on what sort of scenario we're dealing with in their animals and whether or not we're going to be on them long term or just use them as needed.
And at what point do those medications come into the treatment plan?
So good question. If I have an isolated incident where my dog got scared one time, they probably don't need to be on anxiety medications. It's really the dogs that are either predictably scared of the same thing over and over, or the dogs that really have this heightened behavior problem constantly that we start talking about behavior modification drugs. We start with physical exams to make sure there's no underlying health problems going on contributing to those behaviors. But I often will recommend training or consultation with a boarded behaviorist before we get on too heavy of a spectrum of medications. But really better living through chemistry. So a lot of those situational anxieties or the generalized anxieties do better with some sort of medication and just give them a better quality of life.
So definitely consult your veterinarian if you have any concerns before you do anything.
Yep.
To help treat that anxiety.
They're prescription medications anyway, so they would have to have a physical.
Okay, yeah. Dr. Guernsey, thank you so much for being with us today.
Thank you.
And if you'd like more information about University Veterinary Care Center, just head over to universityvetcare.com.